So essentially what's going to happen is that we're going to rely on consultants to fill in for junior doctors who, as your report earlier emphasised, make up more than half of the medical workforce. And it's going to be tough to maintain those emergency services, to maintain that urgent care. But even if we manage to do that, what will happen is we'll virtually have to stop all of the other things that we do. And that's why we're estimating 250, maybe up to 350,000 cancelled appointments and operations next week. But our members have told us that they're basically having to stop all of that kind of elective care. I mean, I visited a hospital a few months ago, which is a new hospital. It's dedicated almost entirely to undertaking elective care, knees, hips, those kinds of things, very modern facility. In the last strike, that basically had to close down for the duration of the strike. I'm sure that'll have to happen again. So these strikes are going to have a catastrophic impact on the capacity of the NHS to recover services. Because as we've discussed before, Kay, what the health service has to do is it has to meet high levels of demand, presenting themselves at the front door of GP surgeries, accident and emergency departments, at the same time as making inroads into that huge backlog that had built up before COVID, but then built up much more during COVID. And that's a tough thing to do at the best of times. It's impossible to do when these strikes are continuing.